Welcome to Boomer Health at Home. I'm Megan Gervin, your host, Assistant Director of Nursing at AmeriStaff Nursing Services. Today we're joined with a two-time cancer survivor, Andy Aubrey. Welcome to the show today.
Hey Megan, how are you?
I'm good, how are you? So tell
Doing
us
well.
a little bit about yourself.
Well, I grew up in Detroit and went to St. Scholastica grade school and then moved out to Birmingham, went to Brother Rice and later Central Michigan, fire up chips, and have been in manufacturing sales since 1986 actually, and I work for myself now and automotive supplying primarily, but yeah, I learned about your show here as a way of maybe getting my story out, which is as a cancer survivor.
Very good. And hopefully to help some others out there and get word out.
That is the goal, yeah,
Okay.
here. I was actually diagnosed with colon cancer at age 40 in 2003. And I think a common response most people get when they first find out they have cancer is, why me?
Mm-hmm.
Why is this happening to me? And subsequently, throughout a second cancer diagnosis in 2019 for stomach cancer, I'm still here, and one day woke up and asked myself, why me? Why was I allowed to survive? And the answer kept coming back to, there must be more for me to do here on this earth, and that came back naturally to trying to help other people. Because people are diagnosed with cancer every day, and it's a pretty scary thing. And I'm here with you today to try and just tell my story and give people some encouragement and some hope and some comfort that there is life on the other side of cancer for a lot of folks.
Yeah, and I think too with the colon cancer, it's a silent killer. It's honestly, one of the worst ones because it's, it doesn't have a lot of symptoms, and then all of a sudden, bam, you're pretty far along by the time you get diagnosed. So the fact that you're sitting here with us today is absolutely fantastic.
Yeah, I was very fortunate. People ask me, well, how did you know? What were your signs? Because at 40, they now say that the guidelines for colonoscopies start at 45. It used to be 50, but they're seeing so much more people like myself who are diagnosed at a younger age that they've bumped that down quite a bit. And for me, I worked out a fair amount. It felt almost like I had a golf ball in my pocket, which turned out to be a 6.5 centimeter tumor that they detected through a colonoscopy, and thankfully it had not spread to my lymph nodes, and they were able to remove it, actually laparoscopically. I had 8 inches of my colon removed with a chemotherapy regimen that was precautionary for 8 months, and that was how I'm still here today, frankly.
Yeah.
So, but incidentally, I was tested genetically and became aware of the fact I'm positive for what's called Lynch syndrome. And Lynch syndrome is a genetic defect that shows proclivities towards digestive cancer, so hence the colon cancer. And then subsequently, later in 2019, discovered that I had another tumor in my duodenum, so I had what was called a Whipple procedure. And what a Whipple is where they basically remove half of your insides. I had half of a stomach and small intestines removed. And again, thankfully, not positive with the lymph nodes. And I didn't even need chemo on that occasion. So we've made a lot of strides. There's been some incredible advancements in the world of cancer treatment. And but it's complicated and can be scary for some, and hopefully I'm here to put some folks' mind at ease today.
Yeah, and put a face to it and make it a little more personal.
Right. Yep, exactly right. So, but you hear it a lot. You hear early diagnosis, and it's not a cliche, it's true. The sooner they can catch and detect these cancers, the better chance of success you'll have. So, if I can urge anyone out there, if you're thinking of getting a colonoscopy, you're past due, you're putting it off, please don't. It's very easy. There's a mystique surrounding the prep involved in the clean out and all that, and people are wary of going into medical facilities with COVID these days, understandably, but I've had a couple colonoscopies since COVID, and I can assure everyone out there that the precautions are being taken in hospitals and medical centers, and it's very urgent and important for you to learn these things as early as possible. And that was the case with me. They were able to work with it and eradicate it.
Yes. I know my sister too, she has ulcerative colitis, so she's had many colonoscopies, and actually my parents went with her the one time and they did, all 3 of their colonoscopies at the same time, which they said had never happened before. It never occurred in the medical facility, so it was a little fun for them. But
Right.
honestly, the colon prep, yes, it's a couple of medications, clears you out a little bit. It's not the end of the world. It's one day, and it's one day of your life, but it's to keep your life, and make sure that you're still going to be here.
Yeah,
So
exactly.
Yeah.
Yeah. I mean, you have to ask yourself, what's a little inconvenience for the sake of maybe catching something? A polyp can turn into a tumor. That's probably what happened with me. And so, again, I was just very fortunate that timing worked out the way it did. And, I'm still here. I live to tell.
Yes.
So.
And like you're saying that you actually have a genetic predisposition to it. So when people go to the doctor's appointments, I think sometimes they blow off that family history portion and they don't really focus on that as much. And they kind of think, oh, well, grandpa died of a heart attack. Well, it's something to ask your family. It's good to go back and find out, well, what did they have? Was there something that we should be worried about? And kind of look into that, because then they know what to test for, right? There's so many things out there that when you go to a provider, it's not exactly easy for them to go, oh, we'll just test you for everything.
Right.
And insurance isn't going to cover that, right? So
No, that's true.
you want to make sure that they're kind of gearing down towards that. So now that you carry that, then your family members know to, tell their doctors that and to go looking for it.
Yeah, absolutely. My kids will be hypervigilant moving forward. In fact, my daughter is positive for Lynch syndrome as well. So she will have annual colonoscopies and EGDs, which is an important distinction for insurance purposes, because insurance companies are generally reluctant to pay for annual colonoscopies unless you have a reason for it. In our case, the Lynch positive is that reason. But that's not the case for everybody, obviously.
Yes.
But it is important for people to get those colonoscopies. I cannot stress that enough, that that early detection is key to being able to do something with the diagnosis. Stage 3, stage 4 means it's spread to other parts of the body. And that can be a lot more of a challenge for doctors and oncologists at that point. So, get out there, folks. It's okay. It's going to be okay, and it might save your life.
Exactly.
So
in terms of the types of care that you had to have, you talked about that. You went through some chemo. How was that? What type of support system did you have? If people didn't have a support system, what could they do? I mean, obviously they can contact nurses, but outside of, nursing companies and such, there is other types of support groups, organizations, places they can get information.
Absolutely. Great question. When I was first diagnosed in 2004, when I went back to the why me part, there were other things going, okay, there's something else that I can do here. This is going to play out for the good eventually, just because that's the way my mind operates. I've been in sales forever, and if you're not an optimist and think positive, you're gone. So I thought, maybe I could start some kind of a support group or get some people together who have been there and done that. And I met a gentleman by the name of Johnny Immerman, and they'd done a story about him in the Our Detroit magazine. And he had just the year before that been diagnosed with testicular cancer. And he was a local guy from Bloomfield area, went to Cranbrook, fair amount younger than me, but he had started Immerman's Angels, which is an organization that was doing what I was thinking of doing, but he'd already done it. So I got in touch with John, and he and I hit it off famously. And I drew a lot of strength from his survival at that point, and the fact that he had the get up and go to start that organization. And what Immerman's Angels does is put survivors like myself in touch with newly diagnosed people, just for the purpose of support and comfort. You have questions about just what was going through your mind, maybe what chemotherapy was like, what your surgery, the aftermath of your surgery was like. Those are all questions that come flooding into your head. And if you're able to connect with somebody like the Immerman Angels group does, and that is trying to put people together sort of with like cancers and like age groups, even if possible. I've mentored a number of people who just called me out of the blue through them, and just they had, an hour or two later, we're still talking. Well, how was this and how was that? How did you react to this? How about your family? They're a big part of it. They go through it with you, whether it's rides to the doctors, supporting you through the testing procedures, the surgeries. All of that's very complicated, and it's a lot to kind of wrap your head around. And the Immerman Angels group does an excellent job of putting people together who can help one another. Another group is here in Detroit, Metro Detroit, Gilda's Club. And people know Gilda Radner, and she passed away of cancer tragically. But started this foundation. They're in Royal Oak. They also have an organization in Detroit and another on the east side. But Gilda's Club is a support group similarly. However, they take it all the way through to from initial diagnosis to the support of the treatments to, sadly, if we lost someone, support groups for family members who are grappling with those losses. So great group there, and familiar with them through having one of their officials on another talk show, in fact, down in Royal Oak a number of years ago. But they're doing great work. And there's others, there's national websites, cancer.org and nccn.org, that will give you an answer, any question you can think of. They'll give you resources to contact others. If you need doctors, you want anecdotal evidence of people that have been through cancer, what they can do to just learn more about the process, because it can be overwhelming when you learn this and your immediate reaction is panic. You're like, oh my God, cancer, I'm dead, that sort of thing. I mean, well, that's not necessarily the case anymore. And we've made great strides in survivorship. And, again, the mental aspect to this is just as big as some of the physical things you go through. So those support groups are really outstanding and helped me too.
I think too, when people hear support group, what they see on TV is more of that, like, a group sitting in a church basement with really bad coffee and,
Yeah.
really bad cookies that are stale.
Right.
But what you're talking about is something more personal, and like you called it kind of like a mentorship. It's a cancer mentor.
Absolutely.
And I think that's a wonderful way to look at it. And they're, like you're saying, too, support groups for family. It's a lot to go through. When I worked bedside nursing, I was in the ICU for a long period of time, and the families, it's a hard hit, but they don't want to show it to their loved one, right? So a lot of times, the nurses, we let them vent to us and hug them and take care of them as well. But it's good to have somebody too that can kind of guide them as well, and, has gone through it themselves. And I think that's one of the biggest things too, is I can say to you as a nurse that, oh, you might have these types of feelings, but I've never felt that before. And I have no idea what it actually internally felt like or mentally felt like. So it's good to have somebody that, like you're saying, went through it. They understand, where it's at and what's going on and where your headspace gets. Like you're talking being, you got to be positive. And I always say my stubborn patients are my best patients, because they, might give me heck, but in reality, they're fighters and they don't give up. And, that's sometimes what you need, or you need someone behind you pushing you, going, nope, you're going to do it and you got this,
Yeah.
kind of pumping them up.
Yeah,
So.
that's absolutely true. I never for 1 minute thought I was going to succumb to this. I just knew I was going to survive. And I know there's a lot of people that have ended up losing the battle who felt the same way. Again, that's sort of in my own mind trying to reconcile why that is. But you do have to have the positive attitude. That is goes a long way towards success. I'll take a minute right now to thank you for your service in nursing. What you do is incredible. My wife's an oncology nurse, Dawn, and she has gotten me through both of these, frankly. First time as my nurse and second time as my wife.
Yeah.
But she ended up being kind of my home care person, because after my stomach cancer and the Whipple procedure, which was pretty major, I went home after a week. Those procedures tend to have some after effects in terms of infection, just because of what went on in there. It turned out I did end up with sepsis, a week later, after being discharged from the hospital, I was home 2 days and back in for 3 weeks actually.
That's a lot.
With it was septic and had IV drips with meropenem, which is an antibiotic, very strong antibiotic to make sure that that infection was gone, and had a wound vac attached to me. I lugged around for a few weeks and ended up having to open me back up again to just make sure everything was kosher. You know, we're good in there, but it was her I give all the credit to for my care and the work you folks do, helping people post-surgery or whatever is needed. From what I understand of your organization, is very helpful and much appreciated.
Well, I think most nurses, we go into it because we want to help people, right? It's our main goal, and it feels right to do that, and we're natural caregivers. So I know that there's some nurses that aren't, and there's always the funny stories about those, the nurse ratchets and the, you know, the bad ones that, you know, the horror story gets told. But for the most part, from what I've seen in, 17 years, it's, most people just want to be there and help out. So
it is. It's a calling, and I don't know where the world would be without all of you, especially after what we've gone through for the last couple of years too.
Yeah.
It's been a challenge.
Yeah.
So.
Yep. Finally back in studio.
Woo, and now we're back in the world. Look at us. So.
I know, look at us go.
Yeah. Anyways, so it's been a journey for me. Again, I have a hard time with some of the people we've lost, and I want to mention a gentleman who we did lose back in 2020 by the name of John Andretti. John was a race car driver in the NASCAR circuit. He actually raced the Indy 500 and a NASCAR race in the same day, 1,100 miles. He flew from Indianapolis down to North Carolina. He was the first to do that. There have been 3 since who've done it. But John was diagnosed. I had met him a number of years prior at several races out at MIS, and just a great guy, and was diagnosed with colon cancer in 2017 and went through a lot of the same things I did. He had surgery, he had chemo, and he was, a great fighter. Started a foundation. In fact, I got a T-shirt I actually sent from his foundation, and it's called "Check It for Andretti." We lost him in 2020, but his legacy will be for people to go out and get those colonoscopies. And I really, that one hit me hard because I did know John, and it's really tough to kind of wrestle with, why him, not me? Why me? Am I still here? That sort of thing comes into play a lot every time you hear about a colon cancer loss and cancer in general. And I can't tell you how many people we've lost even since my most recent diagnosis. So again, that's why I'm here. I want to help people. I want you to know that, we can do this. We'll do it together. There's so many other options too, once things, even if they've reached the stage 3, stage 4 level of cancer diagnosis, again, meaning that it has spread. Palliative care, I mentioned to you off camera earlier, and you're familiar with that.
Yes, very much so.
And maybe you can do a much better job than I can explaining what that's about for people.
So I think a lot of times people think that, because they hear it with hospice, right? So they think it's more of a hospice type of a situation, when in reality it's one of the greatest support systems for patients and families. You can continue treatments while you're in it, and it's not, just for cancer, it's for a lot of other syndromes, and, we transitioned a lot of patients out of ICU into a palliative care scenario, just because, number one, they give a lot of attention to that person. It's a lot of, like I said, support, but also a lot of questions to be answered. Those explanations. Not everyone is fluent in the medical language. Someone might walk in and start spouting off a bunch of words, and then they're like, wait, what? What was just said? I have no idea what that meant. Right. So it was a good support system that way as well, but it is an organization that you can sign up with, and it's through a lot of different systems, a lot of different healthcare, they sign up for it, they have to be certified for it, it's a specialty. So, and then there's specialty, nurse practitioners and doctors that are in that as well. So I'll let you speak to your portion of what you know about palliative care as well. But.
Well, all I know is, again, what I've kind of defaulted into knowledge-wise through my wife's activities as an oncology nurse. And it does sound like an outstanding route for people to be able to take. No, it's not really hospice, but it does give people a much more comfortable existence
Yes.
while they're going through some of these challenges. Whether that's, an intensive regimen of, meds to, I think there's a fair amount of, therapy involved too, just in sort of a holistic approach, if I understand it correctly.
It is, yeah. There's a lot more that's covered underneath it. Like you're saying, yes, there's pain medications. There's different doses of medications that you're allowed to get if you are on a palliative care regime. But, so it's a little bit different when you sign up for something like that. But like you're saying, it's holistic, it's supportive. They help you make a plan too. So say if the worst case scenario is going, and maybe you're not quite with it enough now to speak to that, or what your wishes would have been, and maybe you didn't tell your family that. They help kind of plan that out ahead of time so that when the time comes, okay, if I hit A, B, and C, I want to transition to hospice, or I want to do this treatment. So it kind of helps people kind of, key it in their brain what it is that they're going to want, because we don't like to think down the road, if things go bad. And there's also people that come off hospice and they come off palliative every day. So there are the stories that completely turn around and it's not what we expected and it goes the opposite way. But it's always good to be prepared and have a plan. So.
And I would think those stories are very powerful for people to hear, like the success stories. Again, that's why I'm here today, because I want people to know it can be okay here. I drew strength from the Johnny Immermans, friends of my folks. My aunt had colon cancer about 10 years before me. She was in her 50s at the time, and her and I just went to a concert last week. She's 80,
Very nice.
So you hear those sorts of things. Success is possible. Don't freak out. It can happen. We've gotten, like you said, we've come a long way. Yes, it can be a little overwhelming. There is a lot of testing. You got to get to a doctor for this. You need to go to a hospital for that test. They need to know where anything is in your body, if they're going to have planned surgery for you. A plan of attack is mapped out. Then post-surgery, whether that's chemotherapy like it was for me, whether they get in there and they discover maybe it wasn't as bad as they thought, and you're good. And that was the case on my second cancer. I was lymph node negative and stage 1B, basically hadn't spread. I was very fortunate. So, but there's still a lot. I would recommend people get some organization on hand, though, whether that's bringing a family member to these appointments. Ask your doctor, can you record? We've got our iPhones and whatever these days. Can we record this consultation? Because sometimes the information comes fast and furious at you when you're sitting in that doctor's office, as you know. And so you want to glean as much information as you can. It's coming too fast. You can record the discussions. Again, a support person is very important. If you're fortunate enough to have a family member who can come with you to these appointments, and maybe make a notebook, just with some notes for dates, a calendar, because you might have to be next Tuesday at this hospital, or the following Wednesday you're going to have to submit to a PET scan or a CT scan. The surgery itself, of course. So organization's important, because again, it can boggle the mind when you're trying to organize all of this stuff. And those are important keys to being successful in the long run.
Yeah, and I think too, picking that right person, picking someone that, you don't want to pick your most anxious family member.
No.
You want to pick somebody that...
somebody who's calm, if you can.
Somebody that's calm, somebody that's collected. We really appreciate you being here today, telling your story. I think it is very important for people to hear the positivity of it and to see somebody. Yes, you're still here. Yes, you're still fighting, and you're keeping track of it, and you're making sure that you're preventing, future people from having cancer, or maybe catching it extremely early, to where it's a very fast treatment.
Yep.
Instead of having to go down the line. So.
That is the idea, again. And not just colonoscopies, general checkups, making sure you get, a physical. Yeah. Again, people were a little apprehensive going out into medical facilities. They don't have to over the last couple of years, but it's critically important because, as my wife has noted, people are coming in now with later stages of cancer that may have been caught earlier if they had gone and been more proactive 6 months, a year and a half, 2 years ago. So it is very critical to continue to get those checkups. And I was like, you have a little pain, you don't want to just run into the doctor, but at the same time, is it aging or is it really something? So that's what blood work's for. That's what our general practitioners are there to determine for you.
Exactly.
Yep.
Again, Andy, we just want to thank you for being here today. It's absolutely wonderful what you're doing, getting the names out of the organizations, getting the word out about prevention and how important it is and looking into it. And, if anybody has any questions, they can always call Ameris Staff Nursing Services at 248-288-2270. That concludes our show today for Boomer Health at Home. Thank you so much for watching.
Hi, my name is Greg Jamian, and you've been watching Boomer Health at Home, powered by over 40 years of home health care experience and knowledge, along with our program sponsor, AmeriCare Medical. And please, don't forget to like us if you enjoyed our show.